we're involved in our patients' lives. It's more than just beauty shop talk, right? If your patient just got married and they want to start talking about having kids, can you give them the proverbial walkthrough of the Cancun International Airport? Hey, just so you know, if we don't control inflammation in your mouth and you happen to get pregnant, that could complicate things. And it's a lot easier for us to address decay now. Once doctors got to deliver anesthetic, forget, it can be more complicated. We do see women delivering preterm low birth weight babies, which impacts about 1 in 10 deliveries across the United States. That creates neonatal issues. Can we be a guide for our patients inside of that framework? And I think that's the sizzle. That's where hygienists can really be advocates and leaders for their patients.
Welcome to another episode of the Irreplaceable Dental Assistant. And do I have a surprise for you today? Well, this lady is so bubbly, so effervescent. You can't help but listen, tune in, and feel engaged. Welcome, Katrina. How are you doing today?
Oh my gosh. Thank you so much for that incredibly kind introduction, by the way. I need you to travel with me and introduce me like that every time I walk on stage. That'd be so awesome. Thank you. It's such an honor to be here.
I have had the privilege of being in your audience on multiple occasions. So I am not making this up. I am letting you know what my experience has been. But for the purpose of my viewers, of my listeners, can you share a little bit about yourself, Katrina?
Yeah, of course. So my name is Katrina Sanders. I am a practicing periodontal hygienist. I practice here in sunny Phoenix, Arizona. That's what I do for, I guess, part of my role as a clinical dental hygienist. And then the vast majority of the time I am seen traveling, zigzagging in and out of airports faster than most as the dental hygienist, which is a little personality, a persona, a brand that I've developed over the years as a dental hygiene speaker, as a consultant, and ultimately as somebody who inside of the framework of, all the things that I've done, not only just as a dental hygienist, now I'm building this framework inside of fun things like wine tasting to help kind of humanize and normalize what it is that we're doing inside of our work as clinicians.
Okay, so you have an angel side and a devil side. The little devil side says to me, I wonder if she's trying to get all those wine stains on the teeth.
Oh, you got it. That's it always cracks me up. Like I tell people all the time, yes, I talk about, dentistry and we sip wine and all of these things. And of course, people are like, I can't believe dental professionals invite it. Well, of course we do, right? Wine just makes it so much more fun. It makes it light. It makes it fun and different. And I love it because I think this gives an opportunity for us to really talk about the things that matter most inside of our conversation. I think it allows us to have an opportunity to, sip some wine and talk about what is actually going on. Instead of being so buttoned up in a hotel conference hall where we're, scribbling the notes and doing all the things. Let's talk about what is actually getting in the way or creating challenges or complications around us doing the level of work that we need to, stepping into our power and delivering those standards of excellence in a way that meets the needs of our community. And I think that's the sizzle. That's the secret sauce. That is, I think, where it creates more of a practical application. And how does this, from a reality standpoint, fully show up?
Okay, I love that. I love integrating knowledge into everyday activities that allow a seamless effort to learn while you're just in relaxation mode. That's awesome. Katrina, how do you collaborate with other dental team members to ensure a comprehensive approach to patient care?
I think that's such an important question. And I love that you asked this because that is actually not a very common question that most people even consider inside of what we do. As a dental hygienist, we're so isolated, or at least it feels like we are, right? The rest of the team, you've got assistants who rally around the doctor and are well-versed in what patient is coming in next to doctor's column, and who needs this treatment plan coming out of doctor's new patient consultations. And the front office is wrapping around the doctor and helping to confirm case acceptance and making sure that payments are going through and things like that. Hygienists really have kind of been left to their own operatory in the corner, and it's see those hygiene patients. Every once in a while, doctor will tootle on down from the surgical side or the restorative side and come on over to the dark side and do our exams and then go back and return and treat patients. And I think it's been interesting in communicating with hygienists, in recognizing that we do want to be a part of the team. We don't want to be left alone in the corner to do our own thing. We want to get involved. So I find one important piece early on is recognizing that we can support the doctor, we can support our amazing assistants in so many ways. Things like, hey, I've got some open time. Can I anesthetize a patient for doctor? I've got some open time. My patient no-showed, they're running late, they can't, whatever might be going on. Can I take that emergency patient back and take some radiographs and start triaging what's going on? How can I help transform or change as a hygienist, as a clinician, and as a leader in the team? How can I help? And I think that's important. If there are any hygienists who are listening, I think that's important because oftentimes we have needs as hygienists that can look like we are draining the operations or how seamless it is on the other team side, right? Anytime that we need to pull a doctor away for one of our exams, oh gosh, that just makes it so much more challenging for doctor and assistants to be able to manage and mitigate. Anytime that we need an assistant to help us perio chart, oh, that just takes another person away from those operations of what doctor is doing. And so again, you can kind of see where that kind of where the hygienists have fit inside of the team mentality has been previously. So on the leadership side, it's things like, where are the bottlenecks today? During that morning huddle, right? Where are the bottlenecks and how can I support as a hygienist? So I'm listening for that during the morning huddle. Oh gosh, we're going to have a challenge with trying to get doctor from this operatory to this. Great. You know what? If somebody will seat my patient and take their radiographs, I can go ahead and anesthetize that patient for doctor. Would that help? Would that make things easier on everybody else? Of course. Now we're working not only as a team, but we're working to the top of our license or our scope of practice, which I think is so exciting.
Yeah. So your key message is stay integrated. That's one right. Team, one focus, and the focus is on the patients. However, it needs to be done so that things are seamless. I thank you for that. I really can relate and appreciate that. So Katrina, do you focus on any specific oral health conditions or diseases to address overall health concerns?
Oh, I love this question. I do. I've, over the years, I've fallen in love with perio. I'm embarrassed to say I've fallen in love with perio, but I have. I've worked all scopes of dentistry. I worked in pediatrics, low socioeconomic status communities, high-end cosmetics, family practice. I mean, I've kind of done the round robin, and I will say I've kissed a lot of frogs and I found my prince in perio. So I work with a large group surgical perio practice here in Phoenix, doing perio surgeries alongside our doctors, which is awesome. It is so amazing to see this disease process. But, it's interesting, treating patients in a perio practice, you're also spending a lot of time playing in the space of oral systemic, or as we're starting to see, kind of getting a bit more granular, the perio-systemic link. So inside of that perio-systemic link, this is where I'm constantly seeing patients every time I'm working clinically who have autoimmune disorders or, diabetic complications. And, I'll tell you, it's interesting looking at all these different complications that we're seeing. Patients in a perio practice, we probably see higher concentrations of diabetes and rheumatoid arthritis and cardiovascular disease and cancers and things like that. Those diseases move in tandem or commensurate or bidirectionally with each other. Yes. And yet it is incredible. For example, I was trained in hygiene school. If I have a diabetic patient, that I should ask them what their A1C is, right? Mm-hmm. So, and I think most of us have been trained to do that. Well, here's the thing. These are the realities that we're starting to figure out as perio practices are establishing really strong relationships with hospital entities or medical entities. So we've got a really great working relationship with the Mayo Clinic here in Scottsdale. So one thing that we've started to learn is, and most of you listening to this podcast, you'll probably know exactly what I'm talking about. Diabetic patient comes in, they sit down and you ask them, hey, what's your most recent A1C? And you get that look from the patient like, and you know exactly whatever they're going to say next is kind of a made up number or a guess or I don't know the last time. And you start to think about it and it's like, well, you should have your A1C done every 120 days. That's the lifespan of a red blood cell, right? You should have that done and you should know it. We're in this industry where we're just taking our patient's word for it, right? Well, what about medications? We ask them about are you taking your blood pressure medication? A patient says yes. I can't tell you how many times I'll have a patient come in, I take their BP and it is through the roof. And they're like, no, I take my medications. Then they go home after the appointment and they look in their little Monday, Tuesday, Wednesday, Thursday medicine box. And they're like, oh my gosh, do you know what? I haven't been taking my medications for the past 2 days, right? So those are the things that I think we're also starting to see that involvement within is it's not just, well, is it fluoride I should put on your teeth or no? It's getting more involved in what that systemic pieces. And then I will say, in alignment with that, the third piece that I've been quite passionate about is the airway space. And I know you've sat in audiences where I've spoken. I share quite often the horrific and tragic story of my mother's passing. We lost her actually. It was just the 5-year anniversary of her passing from an untreated, unacknowledged airway obstructive disorder. And I say that because my mom had been treated by an ENT who was actively, tracking and monitoring her airway. And so how easy is that inside of the dental space to just assume, oh, you're seeing somebody about this, so you're fine. Well, the reality is we recognize current data says about 90% of obstructive airway issues are because of something parafunctionally going on in the oral cavity. So we are spectators to that in dentistry, right? We can see those tethered oral tissues, those scalloped tongues, that advanced Mallampati classification. We see those things. Erosion. The acid erosion. And then we also have all this time to sit and talk with the patient, right? Are you a frequent napper? Do you sleep with multiple pillows? How much coffee do you drink? Why do you have to drink so much coffee throughout the day, right? Do you wake up in the morning with headaches? We should be doing more than just throwing a bruxism guard in these patients' mouths. We need to be looking more comprehensively. And so after losing my mom, it really taught me that although a patient might say that they're seeing a doctor, or even if a patient is seeing a doctor, that if we want to be true partners inside of the oral systemic link, that we've got to get involved. We have to start asking deeper questions.
I agree with you 150%. I mean, we actually will stick the finger and check for our diabetic patients.
Oh,
we do a blood pressure reading on every patient who comes in, right? So I agree with you. We are partnering because we're the ones that they're going to see far more frequently than the physician. Just before I came on this Zoom, I have a patient who she's working with a CPAP. We referred her to the pulmonologist. Fortunately, in Jamaica, I'd have to go through a physician I can directly refer. And she's been having some challenges right there in the office. I emailed him. I said, XYZ, 1, 2, 3, blah, blah, blah. We are their support. We are the ones who see all the oral manifestations. Yes. So you are absolutely right. And I'm so glad you brought out those salient points. It's more than fixing teeth. We
Yes.
look at overall health, even though we focus on the oral cavity. But there's so many things that we can be heightened in awareness to because of some of the things that we see or hear. As you say, I'm so sorry to hear about your mom.
Thank
And
you.
the thing about it is, I wish I could say your mom was in the minority, but the more we know, the more we can say, it's not normal
I know, exactly.
for grandpa every time he sits down in front of the TV to fall asleep. It's not
Yes.
normal.
Yes.
He's snoring so loudly that you hear them 2 blocks down the road. You know, these
right.
things that we've seen but not realized that they are telltale signs of life and death situations. So thank you for highlighting that. I have another question for you, Katrina. Can you provide some examples of how you integrate preventative measures into your dental hygiene practice to promote overall health?
Yeah, I thank you for asking this. And I think, and I'd love to get your thoughts on this as well, based on all of the progressive things that you're doing in your practice. It goes back to this concept, and I was thinking about this as you were talking. How often do patients assume that all we do in dentistry is the teeth stuff, right? And so I think about this a lot. My fiance and I the other day were talking about this kind of interesting concept. There's a gentleman who started a business, and this is a sustainability business that he created, where he basically takes the soaps from hotel rooms after people have been in those hotel rooms. This, he kind of goes through a cleansing process or whatever that might be, but takes those soaps that would otherwise be thrown away by housekeeping and I guess melts them down or however he does this, and basically creates new bars of soap that he gives to underserved populations. It's a completely clean process the way that he's done this, but what he's doing is attempting to reduce waste and create sustainability. And so from him setting this up, and he became wildly successful with this, and then it created awareness on the hotel hospitality side that, hey, there's a lot of waste, that we, let people open up these little bars of soap and there's so much waste. So now you're seeing hotels doing like the pump, soaps or shampoos or whatever in their bathrooms. And so they asked this gentleman, a few years later, hey, you've been so financially successful with all of this. What is your answer to the fact that now hotels are creating less waste? And he said, good. That's what I wanted, was for less waste to occur. Like, I'll figure something else out and we'll move on. And so then my fiance was asking me, so what happens if, an injection comes along? Because they've been talking about vaccinations against perio or decay. Like, what happens if we find a way to address those diseases? So what would happen if you didn't have to manage periodontal disease the way you are now? And my response was the same thing that this gentleman said, which is good.
Absolutely.
Because now we can change the framework of what the hygiene appointment looks like. Because we recognize, if you look at prevalences of disease, 47.2%, nearly 1 in 2 of our adult patients already have perio. And then in the population who doesn't already have perio, the vast majority of them have gingivitis. Our population is suffering with oral inflammatory conditions. Dental decay is the number 1 chronic childhood disease, 5 times more prevalent than asthma. Every hour on the hour, 1 person dies from the ramifications of oral cancer. Our population is suffering. They are sick. And so I think about the fact that what we're actually doing right now is delivering oral sick care. That's what we're doing. We're delivering oral sick care. Every time a patient sits down in my chair and they're diseased, I am treating their sickness, their illness, their oral wound. What if we could change that and start doing things like oral health care? Correct. Right? Now I'm able to sit down with a patient and look at that medical history. And now I have the time to talk to them about that link. Hey, if you have this condition and we don't address any localized inflammatory issues, this could become a problem. Now we can get preventive about talking to our patients about things like chlorhexidine varnish, oral probiotics, being very targeted and crystal clear about their oral hygiene practices, and delivering these customized care plans. The thing is, right now, and I say that I travel across the United States and around the world, and every hygienist has the same battle. The biggest battle for us is time. Katrina, you don't understand. We don't have the time. Gosh, if I had all the time in the world, I'd be able to sit and talk to my patient about this. And if I had all the time in the world, I'd let my patient bring in their electric toothbrush and I'd show them how to use it. And if I had all the time in the world, I'd be able to, so I think if we were able to focus more, many of us do this already. And as a periodontal hygienist, when we do a new patient consultation, we are focused on that provision of looking at what are some of those medical conditions and how can we prevent those, et cetera. We're talking about that. That framework is there. We are taking, pulse ox readings. We are evaluating our patients, systemic health in many ways. If the patient's oral inflammation does not resolve with our debridement, there's something else going on. They're HIV positive. They're pregnant. Their hormones are off. They have a nutritional deficiency, an autoimmune disorder. We have to be able to create inside of dentistry the space for this next layer of research that's coming out that should force us to change what we're doing.
So I agree with you, but I disagree with you.
Okay.
I fully agree with everything that you've said, but I would not say the issue is time. I would say the issue is mindset. Because if a dental practice has the philosophy that we're looking at wellness of the whole body, then the day is designed.
That's right.
To accommodate having that detailed conversation, looking at the overall picture, determining if this person just needs debridement or if this one needs additional care. Probiotics, we do that in our office as well. The periprotect, and most of all, getting our patients to realize that we are working with them.
That's right.
What they do on a daily basis, that's the key. Because if we come in every 3 months or every 2 months or every 4 months as needed, and we don't see the daily work.
Yeah.
So we have to take them from the mindset of believing that, oh, Katrina is going to fix too. Oh, Katrina is going to help me to gain and maintain ideal oral health. And this is what I need to do. And I know she's going to be checking for that. So I would say mindset, and that mindset has to be the office and how we approach the patient so they understand that we're not treating, we're helping them to maintain. What they're doing on the daily basis is where the treatment really lies. Because, you
are spot on.
Get every bit of calculus off today, and 2 to 3 days it takes for that soft buildup to become hard. 2 to 3 days, if they have not done anything between, we're sliding down the hill again. So mindset is the key.
That's right.
You agree?
Oh, you're spot on. And I love talking to a doctor about this, that is the first piece that you shared, because I do find that the limiting belief there is time. And I will say this is where we have to see flexibility on both sides. Correct. The existing framework of most practices, at least in the United States, is you get a set amount of time for each patient. Well, that doesn't work if we're telling hygienists, if we're empowering the community to not create a one-size-fits-all approach for our patients, but yet we're going to give the one-size-fits-all amount of time. Right. I shared this, my sister's a foot and ankle surgeon. And I asked her the other day, hey, what happens if a patient comes in and, you've got them scheduled for a procedure and now something else has been added? Like, do you still have the same amount of time? Or because you had to add another step in that procedure, do you get more time? And she was like, now this is a foot and ankle surgeon. She's like, of course we get more time. So I'm thinking about like the hygienist that all of a sudden we discover, oh, now this patient needs a full mouth series of x-rays. Well, an FMX takes more time than a 4 bite wings. Right. So what happens? Now, hygienists have to figure out in that one size fits all. I've been given the same amount of time, whether this patient is a perio maintenance with no exam and no x-rays, Versus if this patient is a prophy with an FMX and I have to update this and I have to update that and I have to update this and I have to update that. Well, now we've got challenges here. The existing framework in most practices does not fully permit us to approach care from a unique patient-centric standpoint. Now, practices like yours, practices like mine, it's very different. I'll get asked all the time, Katrina, how much time do you get for working on doing SRPs? How much time do you get? And I said, I dictate that amount of time.
Correct.
The doctor asks me, how much time will it take you to treat this? Yeah. And then I decide based on what that disease looks like, my idea about how tenacious that calculus is, if I want to take postoperative bite wings on the patient to confirm calculus removal, if I want to perio probe the patient afterwards to get more accurate. I determine that time. I am put in control. But that's where you start to see that balance back and forth, right? Yeah. I recognize that those are limiting beliefs of hygienists. But I also recognize that
it's the practice. Because the hygienist is working within the parameters of the practice. So when I'm saying mindset, it's the mindset of the practice.
That's right. What are your core values? How do you? Yes,
it's the whole view of patient-centered care. Yeah,
that's right.
Yeah.
It's beautiful.
Katrina, I have another question for you. Are there any common oral health conditions or issues that are, you frequently encounter in geriatric patients? And if so, how do you address them?
Yeah. It's interesting. We're in this, I hate to overuse the word unprecedented, but we kind of are in this unprecedented time where patients are now living longer and they're living longer with their teeth.
Yes.
So whereas perhaps some of these populations might have been in dentures, now we are managing patients with natural teeth or dental implants. Right. We do see a decent portion of geriatric patients for two reasons. One, I'm in a perio practice, so we know their risk is certainly higher. But two, I practice here in Phoenix, and everybody gets smart when they retire and they fly down and they stay here in Phoenix for the beautiful time of the year it is to be here, right? I was laughing about that. I'm an avid jazzerciser, and when all the snowbirds come, or when they come back into town, because now the jazzercise classes are full of everybody who's come back from the Midwest or whatever. So we do see a lot. And I will say in the geriatric population, I'm seeing a few things right now. The first is I'm seeing really high cases of oral lichen planus. And we're seeing that primarily in our female patient population, our perimenopausal or postmenopausal women. And we're doing the research on it. There's been some data about, could it be possibly fungal in nature? We don't know. We're not giving them antifungals, but we're starting to see that there could be an oral dysbiosis associated with fungal complications. So we're giving those patients broad spectrum antimicrobials that have an antifungal component to it. One other thing that we're seeing quite a bit is, of course, the increase in medications that our geriatric patients are taking, which does a few things. Xerostomia, of course, we're concerned about dry mouth. We're concerned about tissue overgrowth. But one other critical piece that we're seeing is that many of these medications inhibit nutrient absorption. So we're starting to see many concerns around, okay, if you are on some of these medications or supplements, we may have an issue with, B12 absorption, etc. And I will say too, there are, and this is kind of an age-old statement, there are two populations of individuals who are routinely nutritionally deficient. The first are young men who go off to college because now mom's not cooking for them and they can make whatever nutritional choices they want. Yes. And tragically, the second is widowers, older men whose wives have passed away, where they are now needing to prepare food for themselves. And I even noticed that too after mom passed, and I'd go up to Wisconsin to visit dad, and I'm like, Dad, you can't just eat like a bratwurst on a bun for dinner. Like where are your vegetables? Like, where is like your fiber? Like, where are you, so things like that. So we do see a lot in the way of those nutritional deficiencies, which is really starting to accelerate systemic issues. And of course, poor nutrition acquisition leads to poor healing. So we do see complications. We see, infection can spread a lot faster. The immune system is not as resilient. I would say those are some of the major things that I see on the soft tissue side as a periodontal hygienist.
Wow. I had not thought about nutrition and specifically those two target groups, but it makes so much sense. When my son was going off to college, I brought him in the kitchen. I said, listen here, we're going to learn a thing or two.
This is a vegetable. Let's look at the food pyramid, right?
With men who have lost their wives.
Yeah.
You are spot on with that. And I guess too, the other thing I would add to that, like people who with age have arthritic type conditions, so they're not able to grip the manual dexterity what it should be. And so sometimes we have to help them to work with, like putting a ball on a toothbrush so that
that's right.
Their grip and so some basic things. But yeah, I really think that geriatric dentistry has to be looked on as an entity unto itself, because there's so many factors that are slightly different from the general population. But thank you for sharing those things. Let me ask you about hormonal changes in females, like during puberty, pregnancy, and menopause, the impact of the oral flora and the overall health. What are your thoughts on that?
I love that you said the impact on the oral flora, because that's huge. And I think that's the piece that we're just now starting to dive into, is what hormones are doing to influence that microflora or that oral microbiome. So there's a very special bacteria, and she loves hormones. Her name is Prevotella intermedia. Campylobacter gets involved in that a little bit too. Campylobacter is kind of just like along for the ride. But P. intermedia loves sex steroid hormones, feeds off of sex steroid hormones. So when those steroid hormones are in high concentrations, that bacteria will predominate. And of course, that's where we start to see complications across the board. Puberty-induced gingivitis. I have patients all the time, female patients who will say, I'm on my cycle right now. Is that why my gums are a bit more tender today? Or is that why, I'm bleeding a bit more? Well, of course we know that. Women who are on oral contraceptives, women who are going through fertility treatment, holy cats, like that's a whole other thing. Men experiencing erectile dysfunction. We even look at pregnancy. We look at postpartum. We look at nursing women. We look at women just in general. Women who get a lot of chin hairs will have higher levels of testosterone oftentimes, right? I know exactly. I just tweezed mine this morning, so I felt a little bit more confident to say that. But women who get chin hairs are, likely going to have higher levels of testosterone. We know that soy can consumption in your diet can mimic estrogen. So depending on that, we can see influences there. And then hormones are even going to be looked at inside of, your adrenal relationship. So stress and, higher levels of cortisol and things like that can also be heavily influenced. So our hormones set a lot of the tone. And I think what we've done for so long in dentistry is looked at somebody who's got a hormonal issue and we say, well, yeah, that's just because of your hormones. Because we know what it is. It's like, all right, well, this is why your gums are fire engine red today. Well, I think we have to take that a step back and say, it's a combination of the hormonal imbalance and biofilm that is creating that toxic display of this disease process. So instead of saying, well, your gums are swollen, but that's just because of the puberty. Once puberty is over with, then all this too shall pass. Instead, we should be saying, as long as, little Billy is in puberty, or as long as little Kimmy is going through puberty, we need to change what we're doing. because we know that this bacteria is going to be in higher concentrations and we need to be addressing this a lot faster, sooner, etc. Then we look at that, perimenopausal, and we're starting to see, some of those changes as well for women. Then we also look at things like women who are going through ovarian cancer, PCOS, endometriosis. Oh gosh. I mean, all of those things, can certainly influence. We've heard our female patient population say, that threw me into early menopause, etc. Well, that creates a lot of complications. And we start to see introduction of oral bisphosphonates or injectable bisphosphonates and things like that. And so it just creates this cascade. And so it's important when you talk about prevention, which is what you had asked earlier, can we be guides for our patients in that, right? I think about this, we're getting married at the end of the year, and my uncle and aunt who have never traveled internationally, they're in their 60s, they've just got their passports for the very first time. Which is so exciting, right? But they're freaked out. They're so freaked out to go to our destination wedding. And so I went through this step-by-step process with pictures about what the Cancun International Airport looks like, so that Uncle Russ and Aunt Monty know how to walk through the airport. Well, can we do that for our patients?
Absolutely.
When it comes to this, can we say, you're going through, you just got married, right? Dale and I will be getting married at the end of this year. We want to start talking about having a family. We're involved in our patients' lives. It's more than just beauty shop talk, right? If your patient just got married and they want to start talking about having kids, can you give them the proverbial walkthrough of the Cancun International Airport? Hey, just so you know, if we don't control inflammation in your mouth and you happen to get pregnant, that could complicate things. And it's a lot easier for us to address decay now. Once doctors got to deliver anesthetic, forget, it can be more complicated. We do see women delivering preterm low birth weight babies, which impacts about 1 in 10 deliveries across the United States. That creates neonatal issues. Can we be a guide for our patients inside of that framework? And I think that's the sizzle. That's where hygienists can really be advocates and leaders for their patients. Absolutely.
I love that point. And Katrina, you may be in a practice where you're limited to X amount of time to get it done, but there are creative things that we can do. Videos, anybody can upload on YouTube now and send the link and say, listen, this is for you. I want you to go through this. We can talk about it briefly at the next time we meet. There are creative ways that we can work around a system if we can't control the system, but it's the mindset again, right? Understanding, what can I do? What do I bring to the table to make a difference? This is what I can do based on the limitations that I have. So thank you. So one last question, Katrina. Inquiring moms want to know, what is the secret to getting preteens and teenagers, especially boys, to be less resistant to proper oral care? I mean, at that stage, that there's far less adult supervision, right? One of the things that you can market like white on rice. That age, the supervision is not what it should be. They're all into boys or all into girls, and the hygiene just goes. And
that's so weird, right? Now you're interested in the opposite sex, and you decide not to take care of your teeth. Hello. So it is kind of funny. This is how Listerine got invented. Listerine was actually used on surgical floors to clean, the surgical floors, and men started putting it in their mouth, and they were having these issues where their wives didn't want to sleep with them. But after they started using Listerine, all of a sudden now their wives were a little bit, happier to crawl into bed with them. How funny is that, right? So we knew how important oral hygiene is. We know that. A few things I'll say. First, it has to start pre-puberty. Yes. And I think, parents get so wrapped up in doing a lot of the oral hygiene care for their children. And that makes sense when they're babies and you're just using a little xylitol wipe, or you're trying to get that dexterity down and you're trying to show them how to brush along the gum line area. But the most successful cases I've seen is where mom and dad have been involved in the good morning and good night routine, where it's, okay, you're going to brush your teeth. Here's what that timer looks like, and having that be a condition that the kiddos are used to, so that it just kind of creates a natural cadence or synergy as they enter into puberty. The other thing you have to look at too is, what are their motivators? And although their motivators may not be, I'm going to debride the biofilm from my subgingival area, right? That may not be a motivator. Oh, white teeth always is a good motivator, right?
Yeah.
Having white teeth. So, you mentioned earlier PerioProtect, a really great opportunity if mom and dad are saying, they just won't brush. I don't know what's going on. Would they wear something in their mouth that's going to help to reduce that biofilm load and whiten their teeth? Would they do that? Oh, so now we have to get creative about what are some things that we can do that will help motivate them. I think that's really important.
So you hit the nail on the head. People don't always do what they need, but they'll always do what they want. So the importance for us is to try to make the need a want.
Yes.
Fresher breath, whiter teeth, looking more sexy. Whatever.
That's right. Yeah. Absolutely. But and you're spot on with that. That's the thing is, how many times do we have patients come in who have periodontal disease, and we're trying to talk to them about doing the non-surgical approach, and they would only want to talk about whitening, right? I mean, it is hard because we have to look to what their motivator is. And with a young teen, their motivator for sitting in the chair is, my mom brought me, I have to be here, right?
Exactly.
And they don't necessarily see that in the same way that our adult patients do, who do make that active choice to come in, sit down in our chairs and subject themselves to whatever we're going to throw at them. But I think there's some really terrific value inside of having that conversation with the patient, understanding what their barriers are. I did this with back when I was working in a low socioeconomic status population, and I asked a young teen, hey, what's holding you back from brushing your teeth? Now, in the low socioeconomic status community, a lot of times I heard, I don't have my own toothbrush. I share with my sisters and my brother. So, okay, well, can we fix that in a dental practice? Yeah, here, take 3. Maybe it's things like talking to them about a routine that would work. Maybe, hey, would you bring a little travel toothpaste and a toothbrush with you to school? And would you brush your teeth in the bathroom with your friends after lunch?
Yeah.
I don't know. Getting really involved in rolling up your sleeves and not just preaching and saying, you need to brush and floss. And why are you not brushing and flossing? And you should brush and floss. And have I mentioned brushing and flossing? But instead, hey, let's find a way to make this work for you. I'm a partner alongside you.
Exactly.
Right?
The custom care that you mentioned.
That's right.
That's the key.
That's right.
The custom care. Understanding who this person is in your chair and helping them to find solutions that will be a win-win. Right. Oh my goodness, Katrina, I could talk to you forever, girl.
I know.
On the same page.
That's so fun.
Things. I always ask my guests, is there a favorite quote that you would like to leave with us today?
Yes. And I'm going to preemptively share why I'm sharing this quote.
Okay.
I travel quite a bit and speak on stages where I'm sharing new ideas about dentistry, or in communicating with people like you. This is not a new idea. This is a normalized idea that you've integrated into your practice. But it seems as though dentistry is so tethered to this concept that that's the way we've always done it.
Exactly.
And oh gosh, how toxic of a statement is that, right? It keeps us complacent. It holds us back. And I think what it does too is it bullies the clinicians who do want better. It bullies the clinicians who have a bigger idea. And so when I travel and I speak and I share, hey, we should be doing this. Why are you not asking your patients about this? Consider that. Come on, you guys, we can do this. I'll have hygienists come up to me and say, thank you for sharing that, because I want to do that, but maybe my colleague in the operatory next door doesn't, or I'm not supported by my doctor in doing those things, but I still want to do them to help support my patients. So thank you for normalizing for me that it is not only okay, but it is celebrated that I'm doing these things. So my quote, this is an old ancient quote. My quote I want to share is, "Those who danced were thought to be quite insane by those who couldn't hear the music."
Oh, I love it.
Isn't that incredible?
Say it again.
Those who danced were thought to be quite insane by those who couldn't hear the music. And it's okay. It's okay if you are the one listening. It's okay if you're the one who's listening to the podcasts and reading the articles and taking the CE. It's okay if you're the one that hears the music and is dancing and is choosing to do better for your patients. Those who can't hear the music, they're going to look at you like you're insane. And that's okay. That's not what we do inside of dentistry. Is not about making dentistry comfortable. What we are here to do is to make dentistry better. Not to make it complacent and easy for those who are negligent and those who just want to clock in and clock out and prophy palaces and all, that's not why I'm here. That's not why people like you are here. We are here because we see something better and we want to help serve and support the health, wellness, and vitality of our patients. So if you hear the music and you're dancing, that's okay. You should be celebrated for that. Do a happy dance and celebrate that. Right?
Recognize that if you are dancing, it's because you're an innovator. You see before everybody else catches up. So don't let that discourage you. Recognize that you're an early adapter. You are a leader. You are a thinker. And not everybody has that skill. So some people go ahead, others follow. And it is to be celebrated if you are an innovator. So dance and keep dancing. Katrina, you have to promise me one thing. One thing. Drum roll. That you will come back and share with us on another occasion. This has been so wonderful.
Same.
Oh my goodness. I don't know if you can feel what I feel, but this has been such a seamless conversation. I feel like somebody was in my head verbalizing what I'm thinking.
Yes, we're the insane ones, apparently dancing the same dance. Which I just love so much.
We are. Well, thank you for your time. Thank you for your expertise. We're filming this in October, and it is the month that we celebrate dental hygienists. So kudos to you and all the dental hygienists that help teamwork to make the dream work.
That's right. I love that. Oh, that's amazing. Yes. A hearty cheers to all of my fearless dental hygienists out there, and a happy National Dental Hygiene Appreciation Month. So exciting.
What a wealth of information today. Listen, Katrina was just awesome, off the chain, loaded with information, filled with energy. And what did we take away? The importance of custom care for each patient. So many people coming from so many different backgrounds, different challenges, different age ranges, a different sex each time. Understanding that it's not just a one size fits all. We have to find a way to make each person feel that their need is a want, a way to motivate them to do what's best for them. If we can do that, we can dance. You're not insane. It's okay if they don't hear the music. Continue to dance. We've talked about a lot today. Sex, hormones, sexy smiles. I don't think I've made a podcast before that's been so risque. But hey, to all my hygienists out there, kudos to you. You continue to make that dream work. Listen, life is better when we live, learn, and grow together. See you the next time. If you haven't subscribed, please do so. Share with a friend. See you the next time.